Let me ask you this. If cholesterol were truly the main cause of heart disease, then why do half the people who have heart attacks have normal LDL levels? And there was a study of like 136,000 people who had heart attacks, went to the ER, and 75% had a, quote, normal LDL level. So that begs the question, then what the hell's going on here? You go to your doctor, they check your labs, they do a cholesterol test, and they do the wrong one, by the way. And that's why at Function Health, we do the right ones, including ones you never get from your doctor, like APOB, which is far more important than all the other cholesterol tests, and Lp(a), which most people don't check, which is a highly important genetic marker. So you got to know your numbers, but you got to know the right numbers. So doctors check your old cholesterol number. They see your LDL's high. They go, oh, LDL high, let's get lower, take a statin, without really much thought. And that's unfortunate because it's a much more nuanced problem than just a statin deficiency that's causing heart disease. Now, the latest research shows that we need to think about this differently. With my patients, I've also learned a lot and how variable people respond to different things. I've had people with extremely high cholesterol that do extremely well on an extremely high-fat ketogenic diet and lower their cholesterol, and other people who are the opposite, who will take a keto diet and actually make their cholesterol worse. So you've got to really look at individuals and figure out what's going on. Here's what I used to believe. I got trained like every other doctor that LDL was the issue, that you had a high cholesterol, high LDL, that causes heart attacks, cause and effect. And the goal was to lower your LDL no matter what, at all costs, get it as low as possible. We also learned that saturated fat is bad because it can raise your cholesterol, particularly LDL cholesterol. So the message was pretty simple, but it wasn't accurate for most people. Real life clinical work really changed that simplicity. When you graduate from medical school, you think you know everything, but you start practicing medicine, and after 30 or 40 years, you really don't know that much, and how everybody's different, and there's not the simplicity that we think applies to certain things like LDL, heart disease, statin, cure. It's just not so simple. We've treated cholesterol like a villain, but the truth is really way more nuanced. What did the old model get wrong? Well, the new science that's emerging has identified a couple of key problems. The first is that total cholesterol is actually a poor predictor of heart disease. Up to 50% or even more in some of the studies of people who have heart attacks have a, quote, normal LDL level. The risk really comes from something that's not being tested by almost every doctor in the country. I mean, I asked Quest, who is our lab testing partner at Function Health, how many cholesterol tests use the right cholesterol test, which looks at the quality and the size and the number of your cholesterol particles, not just the weight of them, which is what you get with your normal cholesterol test, but the quality and the size, whether they're small or big, whether they're dense or not, and how many of those particles do you have. And you know what they said? Less than 1%. 1% of their tests do this. The second big aha that came actually since I graduated from medical school, probably in the late 1990s, maybe early 2000s, was the insight, particularly from Harvard and the scientist Paul Ritger, who wrote a very seminal paper in the New England Journal of Medicine that it was inflammation that was causing heart disease, not cholesterol. He even showed that if you had a high cholesterol and low inflammation, your risk was pretty low. But if you had a high cholesterol and a high inflammation, your risk was higher. Even if you had a high inflammation and a normal cholesterol, your risk was higher. So the inflammation is what's going on. So your arteries are inflamed, and that's what causes the cholesterol to get deposited. Cholesterol isn't bad. It's bad when it gets oxidized or turns rancid. When you look at data from Harvard, Cleveland Clinic, in these large meta-analysis, actually the CRP, this is another test your doctor's own check, and it's on the function panel. This high sensitivity C-reactive protein is important, maybe more important than LDL in predicting heart disease. Now, what is causing this inflammation? And this is what most people don't realize. Aside from a certain subset of the population who has a genetic cholesterol disorder, which is independent of your metabolic health, and who do get heart disease, and that's a very small number, maybe it's 10%. The real problem is what we call metabolic dysfunction. This means prediabetes, insulin resistance, anywhere along the spectrum where your body is not dealing with sugar and insulin very well because you're eating a high starch and sugar diet and you're not exercising or you have extra belly fat. I mean, you have a little bit of belly fat, you're starting to get this problem. And you get high insulin resistance, and that means your cells don't respond to insulin, so you need to make more and more and more to make it work. And that causes what we call atherogenic dyslipidemia, and that's a mouthful. But what it means is athero means plaque. So atherogenesis means plaque, atherosclerotic vascular disease, hardening the arteries, whatever you want to call it, clogs in your arteries from plaque, from cholesterol deposits. That is caused by these small, dense cholesterol particles. It's not the cholesterol itself. It's when they're when you have insulin resistance, and that drives inflammation. What's really important to understand is that LDL is an LDL is an LDL. There are different types of LDL. There's large, there's medium, and there's small sizes, and then there's the number of particles. So think about the weight of a cholesterol would be if you get your cholesterol number of 100 or one LDL 130. And that just means the weight of your cholesterol, but it doesn't tell you how many LDL particles that is made up of. It could be 1,000 small particles or it could be 100 large particles, but you don't know that unless you do the right test. And that's really, again, why we did Function Health. Now, we have to understand it's not just cholesterol as a simple problem. It's nuanced, and there's many different types of cholesterol. There's different sizes. There's different types of HDL and LDL, and so you have to really have a more nuanced understanding and what's causing it. But the real take home here is that, here's the headline, it's sugar, not fat, that's causing you to die of heart attacks. It's sugar, not fat, that's the problem. If you love that last video, you're going to love the next one. Check it out here.